right?
Right.
And so if it destroys the elastic fibers, and we're going to talk about blood vessels. So the arteries, they have elastic fibers. Of the 3 blood vessels, arteries have elastic fibers. And I'm sure you understand why. Look at your heart. It pumps all of the blood. Where is it going to go? Out to an artery. So an artery has to be able to expand, don't you think so? To accept or receive all of that blood. And then, after it expands, it should be able to constrict again or go back to its original shape. That elastic recoil of the elastic in the aorta actually is helpful in maintaining that pressure. So, you see, the pressure is still maintained to pump the blood to your pinky toes. Does it make sense? Cigarette smoke damages that elastic fiber. Wherever you have elastic fibers, that's being targeted by cigarette smoke. So you see the consequence? The hematocrit goes up, and then they have arteriosclerosis. Very good ingredients for stroke to happen. Okay? So I think you'll be okay for your test on Wednesday. I forgot that we don't meet on Monday. Okay? Good luck.
And we can keep our worksheet until after the test.
Your endocrine worksheet? Yes, you can keep it. Take it with you. So we already studied the heart. We looked at the function of the heart. Remember, there's 2 parts to the study of the heart, right? The conducting part and the contracting part, because the heart is autorhythmic, it beats on its own. So this one stimulates it, the pacemaker, right? That's why I remember telling you that there's 2 types of drugs that treat heart problems, right? Inotropic and chronotropic. Remember those 2 terms for your next lecture test. Okay?
Inotropic and
Chronotropic. Okay? Excuse me. So, and then I remember talking about the EKG. You understand the importance of calcium. Remember how we discussed there's a little bit of a very, very important difference between typical muscle physiology, skeletal muscle physiology, you compare to the heart muscle physiology, how calcium, extracellular calcium is key. Remember that calcium-induced calcium release. So now we're going to look at the life cycle of the heart. Slide 58. You can use this one or you can use this one. Your lecture test on the heart and blood vessels, I think had this one.
That's which slide?
59.
You'll be able to find out which slide. No, you can tell which slide because it's the one that's colored yellow. You see, if you see this one, you see where the yellow one is.
Oh, I can see everything else, but I just can't see the numbers.
Oh, I see. Okay. So, your next lecture test on the heart and blood vessels, I remember having this one. To me, this is very important because this is the life story of the heart. So, what I would do, I would have the picture like this. I would leave these things, of course, covered, and I would have the starting point to where the event happens. Of course, I will label it. There's the ventricular pressure, etc. This is labeled. Oh yeah, ventricles. So, but this one, I'll just leave it blank. Of course, the EKG. Either I'll use this one or this one, whichever. Okay? So that's at least 10 points there for your second lecture test. Know that it will come out. This tells us the story of the heart. This is the conduction part. And then as you stimulate it, it will contract. And when it contracts, of course, as the heart contracts, the blood volume that is inside, it changes. This is what this slide is telling you. I promise you, once you master this one, you already understand what's going on in your heart. The heart, you need to know that the heart and the blood vessels, this is your main transport system. Just think about it. Your body cells are always making waste products. Where is the waste? How are you going to get rid of the waste? Has to ride in the transport system, which is your blood vessels, which is the key to make sure that your blood vessels, it's always moving. The heart, right? How do you deliver nutrients from your GI tract to the rest of the body? The heart has to transport. It's the key to pushing the nutrients. Your blood vessels. You always have to have healthy blood vessels and healthy heart. You want to take care of these organs. If you bought the book brand new, you go to Mastering A&P and you click on cardiovascular. In the past, a lot of my students, they say when it comes to this lecture, this test, that part of Mastering A&P helped them tremendously. It was just like a breeze when they took this test. So maybe it will help you also. Okay? So we will start with the valves closed. We will start with all the valves closed. Now it's very small. Okay, so look at this one. So the P wave is, what does P wave stand for? It depolarizes the atria, right? So right after, you know that, just imagine in your head, the blood is being returned from the vein, the spirit, inferior vena cava. By the way, the events that are going on in the right side are also happening on the left side, both at the same time, okay? So, as the blood is being returned to the right side by the superior vena cava, from the superior vena cava and inferior vena cava, and of course you also have the coronary sinus, that's from your heart, right? As this gets filled up, and here the blood is being returned by your pulmonary vein, so it's always, they're both going on at the same time, okay? So as the blood is being returned here, this one is being stimulated by my pacemaker. So when it's finally filled, it gets stimulated, it contracts, atrial systole. So during atrial systole, if you look at the atrial pressure, during atrial systole, the atrial pressure, does it make sense? You start with the valves closed. If this contracts, the pressure increases to the point that it will eventually open the valves. Right? Yes, everybody? What you think? Okay? It will eventually open the valves. That's what happens, right? So, see, then the atria will deliver the blood from here to the ventricles. That's the result of atrial systole. So the atrial pressure goes up eventually, and the blood is going to be delivered from the atria to the ventricles. So look at the volume of the blood in the ventricles. So this is ventricular volume in ventricle. Because the atria delivered the blood from here to here, you look at the volume of the blood in the ventricle, it gets filled. So now this gets filled with blood. Okay? In the meantime, the pacemaker travels, right? When you look at this one, the QRS complex, this is depolarization of your ventricles. So when the ventricles depolarize, what will happen? The ventricles contract, ventricular systole. So we look at the ventricular pressure. look at the pressure goes up. When it contracts, right? Do you remember? When it contracts, is the turbulence of the blood is going to first push the AV valves closed. So there is a point during ventricular systole where all the valves will be closed. There are valves that guard the entrance to the aorta and the pulmonary artery. It's called the semilunar valves, the aortic valve. Okay? Do you remember? Again. So we're going to look at our... What happened to the markers? So from the ventricles, there's this output, right? This is the left ventricle, that's the right ventricle, right atrium, left atrium. So this is your aorta, and this is your pulmonary artery. And there's valves here. They're called semilunar valves. You can just write aortic valve, pulmonary valve. Okay? So the valves are in your AV valves and the valves going out to the arteries. So when I said we start with all valves being closed, right? So we started with all of the valves closed. Now we got to the part where this AV valve was open. Here. The AV valve opened and the blood entered my ventricles. And I'm going to go back to this part right here. The ventricles get depolarized. The result is the ventricles will contract ventricular systole. So that's why the pressure goes up. Right? So when the ventricles contract, it already has all the blood there, right? The turbulence, it will cause a turbulence to close the AV valves, right? So there is a point during ventricular systole where all the valves will be closed. The volume does not change. That's why this is referred to as isovolumetric contraction, right here. Isovolumetric contraction. And when the pressure gets so high, enough to push open your aortic valves, that's the only time that it will be able to dump the blood from here to here. Do you follow? Everybody, what do you think? Yes, ma'am. What do you think, everybody? Yes? Very easy?
No.
No? We're going to do it again. Okay? Let's start again. Let's start. It's very important for us to understand so that we know what's going on with our heart. Okay? We will start again. Start with a nice drawing. So, the nice drawing is going to be the same.
Just a different color.
So this is my right atrium, left atrium, right ventricle, left ventricle. We know in the right you have your superior vena cava, right? Superior vena cava, inferior vena cava, and then I have my coronary sinus. I always add the coronary sinus because I think I remember I used to give a pop quiz and I always say, what are the three openings into the right atrium? We're going to write SBC, IBC, and coronary sinus. And then from the left atrium, it's always veins that return blood to the atria, right? So this one receives blood from your lungs, from the lungs. This is my pulmonary vein. The right and the left pulmonary vein. Okay? So this is oxygenated blood. This is deoxygenated blood. Then we have a valve here, right? The right and the left AV valve. But we start with the closed valves. They're closed. Then, from the left ventricle, there's the output here. This is the aorta. The aorta, from the left ventricle to the aorta, there's another valve. The valves are always from the heart to the aorta. You don't need valves from veins to the heart. They just return blood, right? It's the aorta that needs the output. They need valves because you want to put it out. You don't want it to come back in. Does it make sense?
Mm-hmm.
So that's why you have valves to artery output. So from the right ventricle, this one is your pulmonary artery.
And that's an output also.
Yes. So the valves are closed. So isn't it this one, this is the deoxygenated, look at, deoxygenated blood moves from here to pulmonary artery. It goes to the lungs to pick up oxygen, then return oxygenated blood to the left atrium to here. So you're going to deliver oxygenated blood to the rest of the body. Okay? That's the normal flow of blood. So now we're going to go again, look at this one and study this one using this one. So we start with all the valves closed, meaning these valves and these valves. Okay? So we imagine the heart being empty. And the blood continuously being delivered from my veins, these veins, into the atria. Okay, so as they are receiving blood, the atria is being depolarized. That's my P wave, right? Because it's autorhythmic, so it beats on its own. So you see the P wave. So as this is being filled with blood, it's being filled with blood. This is blood. It's depolarizing. And the result of depolarization, the atria will contract, atrial systole. And if we look at the atrial pressure, see, the pressure goes up, right? When it contracts, it receives all of the blood, it's going to increase the pressure here. You follow that? Okay?
Is the whole heart contracting or only?
No, atrial systole. So only the atria is contracting. Remember the pacemaker, remember the fibrous skin. Do you remember we discussed it doesn't make sense for both atria and ventricles to contract at the same time?
Right. Where's the atria?
Up here.
Okay.
Okay? So, do you follow so far? Because all the valves are closed, when the atria contracts, atrial systole, I am thinking the pressure here will go up. Right? So, look at the atrial pressure, it went up. To the point that it will open up my valves, my AV valves, right? Eventually, the pressure will go up to the point where the AV valves will open. So you see, look at, if you trace this part right here, the brown, the valves eventually open. So the blood moved from the atria. When these valves open, the blood will move from here. Now it will enter my left ventricle. Okay? Now this blood. It's to trickle down, and it's now here in the left ventricle. Right and left ventricle. Okay? So, look, and then if I'm going to go up to this brown part, look at up here. Look at the volume in the ventricle. It went up. Because the blood is now in the ventricle. Okay? Everybody? Now, it keeps moving, right? The pacemaker keeps moving. After it stimulates the ventricles, it's gonna repolarize. After it stimulates your atria, it's gonna keep moving. Remember, from the SA node to the AB node to the AB bundle to the right and left branch to the Purkinje fibers. It will eventually stimulate your ventricles. That's your QRS. So, the result of this one, when you stimulate the ventricles, what do the ventricles do? They will contract. Ventricular systole. So I'm going to look at this picture over here. When this contracts, look at the turbulence of this one will close these AV valves. You follow? The blood will close these AV valves. It will close it. And so you see, but there will be a point where all the valves are closed again. That's what's referred to as isovolumetric contraction. It's contracting, it's slowly increasing pressure, right? It's slowly increasing the pressure, but the pressure increases to first close the AV valves, then it will increase furthermore to then open your aortic and pulmonary valves. Okay? So this one eventually will open. Once the pressure increases. So there's a point, right? Do you see this small line right here? This small part right here, you see? Isovolumetric. It's going up, but not enough to open your aortic and pulmonary valves. Enough to close my AV valves. So that's the first thing to happen. The AV valves will close. And that closing, click, you hear that. That is your first heart sound. So the heart sounds are because of the closure of your AV. The first heart sound is because of the closure of my AV valves. Right? Then the blood will be delivered from the ventricle to the aorta and the pulmonary artery. So I'm going to look at the volume, the ventricular volume. Look at the blood left my ventricle, so the volume goes down. Where is the blood? It's now here and here. So the volume goes down. And it's referred to as the diastolic volume because at that point, the ventricle relaxes, right? After you depolarize, there's the, you repolarize it. This is the ventricular relaxation. The ventricles will relax. Okay? So when the ventricles, look at this one, right? So there will be, when the blood goes up here into the aorta and the pulmonary artery, remember I told you the aorta and these two big arteries have a coating, have a wall layer of elastic fibers. So they expand, right? And then they recoil. So that recoil, imagine the blood is already here, right? The valves are open. When they recoil, that's going to cause some of the blood to go back down there, but that will cause the closure of the valves. That will close the valves so that the blood is going to be pushed out and not back in. Okay? So that will close those valves, click, so that this blood will just go to the lungs and this blood will go to my system. And this closure of my semi-lunar valves will be heard as your second heart sound. And at this point, look at the ventricle is in diastole, it's relaxed. And what happened to the valves? All the valves are closed. If all the valves are closed, there will be no change in the volume here. That's called isovolumetric relaxation. Okay? Isovolumetric relaxation. And then another round happens. It's just, that's what's going on all the time. This combines the chronotropic and inotropic properties of the heart. This one looks confusing in the beginning. But once you just look at it and look at what is this one, what's this one, you understand the words, it's not going to be hard. But like I said, I always had this picture in the past, I don't know about the upcoming, but I'm thinking maybe it will show up in your test at least 10 points. So properly identify. So you see these heart sounds? The first heart sound is because of closure of these AV valves, and the second heart sound is brought about by the closure of the semi-lunar valves. These heart sounds, do you own stethoscopes?
So the systole is the first sound you hear, right? After the AV valves close, and that's pushing the blood into those two, the aorta and the pulmonary. And then when they get enough blood, the valves close, and that's the second sound you hear.
The second sound is closure of your AV, of your semi-lunar valves, right? During the diastole.
Okay.
Yes. You want to maybe invest on a good stethoscope if you're going to go into the nursing practice, and just, if you have friends or family members who are willing enough to be used by you as just take a listen to heart sounds. You will be able to, you want to do a little bit of physical exam, right? You want to train your ears. That's the only way you will be familiar. First, you train your ears on heart sounds, just that, heart sounds. We're going to talk about lung sounds, but now, train your ears on heart sounds. How do you know if it's normal or abnormal? Just for now, listen to these sounds, the S1 and the S2. It should have a solid lub, solid. So predict what happens if there is an insufficiency. If it didn't close properly, let's say, if it didn't close properly, there's still an opening. So, do you think it will be a solid dab? No. There will be like a squishing sound. And those difference in heart sounds, you can only master that, or you will appreciate it the longer you train your ears. There really is a difference. Or you just click on YouTube, it has everything. Just type heart sounds and then just listen to it. But it would be nicer to practice on different patients. Just randomly at home, you have children, you have your husband or whoever. When they're sleeping, you just take a listen to them. That's how you practice. Do you understand this line? What you think? It will be when you go home, don't wait until next week. Just maybe when you go home, look at it and read it. Everything is here. Everything you need to know is here. You just talk to yourself. Hi, someone may think you're crazy. You just start with the EKG and then you trace. See, it's even color coded for you so you know everything that's going on. Okay? Okay? So that one, this one for sure came out in my test in the past. Okay? So that's how you hear your heart sound. See? The first heart sound is secondary to is because of the closure of your AV valves, and the second heart sound detects or is from the closure of your semi-lunar valves. So, now that we know what the heart does, what is the function of the heart? What is it supposed to do really? Why do we have a heart? What should it be doing? What is its job? That's very good. Its job is to push the blood that it receives, right? That's what it's supposed to do. It receives and then it sends it out. So how do we assess the health of the heart? We assess it by looking at its output, the cardiac output. There are two factors that affect cardiac output: stroke volume and the heart rate. Stroke volume. This is the amount of blood that is discharged by the heart each beat. That's the stroke volume. The heart rate is the number of beats a minute. You need to memorize this formula. I remember asking for cardiac output. What is the cardiac output? So, and this is the normal cardiac, you don't need to know this, but this is the normal cardiac output. You should have about 5 liters a minute. That's the amount of blood your heart should be pumping to nourish your body. Okay, but this one is very important for you to know. So you see, this is chronotropic, this is inotropic. You see that? This one is telling me, now you should understand why there are times when your heart rate, it's racing, it's beating too fast. I'm thinking those times when my heart rate is beating too fast, physiologically. Maybe I'm dehydrated, my blood volume is low. That's how the heart compensates, right? Okay. So let's look at several factors that can affect your the amount, the cardiac output. Okay. There are this one here. You have your preload, your cardiac contractility, and the afterload. So this is my heart. This is my heart. Just remember, because I'm going to ask you this one. I remember in my past test, again, on the heart and blood vessels, I'll have a section on preload, contractility, and afterload. I think I would ask, give me factors that will affect the preload, the contractility, and the afterload. Okay. Preload means before the heart. So, preload, the load that goes into the heart. So what is this one? This must be factors that affect venous return. Because it's the veins that return blood back to the heart, right? So, give me a few factors that affect preload or that may change the preload. Maybe you're dehydrated, so then there's no blood return to the heart. So, dehydration. If you're dehydrated, predict your cardiac output.
It's going to be lower.
Lower, very good. So that's why your heart rate should go up.
If you've got peripheral edema.
Yes, it can also be low. Okay? So that's how I wanted to answer. Or it can be also, the preload can be very high, right? So if it's very high, that's when you run the danger of maybe enlarging your heart. Okay. Next will be the contractility. This refers to the heart itself. So contractility refers to problems of the heart itself. So if I ask you examples that affect contractility, you can just write maybe MI, heart attack, or maybe what? Maybe pacemaker problems. That can affect the contraction of the heart. That's all. That's so I know you understand what these terms mean. Afterload is the output, right? After. This is the output to the artery, right? The heart pumps out to the artery. Blood enters through the vein. So preload is vein, afterload is artery. Contractility is the heart itself. So give me examples that can alter or affect the afterload.
The valve's not closing.
Yeah, common examples. Yes, what else? Don't you think when you have hypertension, arteriosclerosis, hardening of the arteries, maybe you can have a cholesterol plaque there. Don't you think that will affect the afterload? Okay? So that's how you want. Does it make sense? These three? You should remember, why are we worried about preload if there is too much preload? Why are we worried about that? Remember the Frank-Starling law of the heart. According to this law, okay, to a certain extent, and don't forget those words, to a certain extent, yes, the heart can expand to accommodate more volume. But do you remember when we were talking about the muscles, how the overlap, you remember the zone of overlap? You remember that? If the zone of overlap disappears because of stretching, there's too much blood return to the heart, will that heart be able to contract? No more. I predict that's also what happens to that lady. You remember? The one who hold your wee for a week. Remember they made her drink and drink and drink water without going to the bathroom. So whoever drinks the most water without going to the bathroom wins the wee. I'm sure you remember that, right?
Yeah.
I predict that's what happens to her. The Frank-Starling law of the heart. Kept on drinking and drinking. There's the preload went up, 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 up. They forget the Frank-Starling law of the heart. When there's no more zone of overlap, how can that heart pump? It cannot pump anymore. Okay? That's why they study they analyze the output of the heart, which is what it should be doing, right? In terms of these three factors that can easily affect it. So you understand preload, contractility is the heart itself, right? You have MI, you can just write MI or heart attack. So this heart is compromised already. And then afterload. Afterload is problems with what? The arteries. And think of problems in the artery, because that's the output, right? So hardening of the arteries or cholesterol plaque in there. Okay? Maybe you have an aneurysm. You can just write hypertension. Okay? So if you don't treat any of these three, so let's say your problem is here. If you don't treat this one, it will be a cascade. It will eventually affect this and then this one. See? That's why we have to treat whatever is the problem. Okay? Okay. So we said that the heart beats on its own. It it has its own, the nervous system and the endocrine system. It does not dictate the fundamental rhythm of the heart. It does not dictate the fundamental contraction ability of the heart. However, your nervous system and your endocrine system can modify your heart rate and your contraction. We know that, right? And look at, this is, to me, I always like, it's amazing how God made our body. Look at, very strategically located. In your aorta, which is the one that receives the bulk of the heart, the initial that receives all of the output. Look at what's in there in your aorta, the wall of the aorta. You have baroreceptors. You go up a little bit to the carotids, which is the first big blood vessel, big artery. You have chemoreceptors. What do baroreceptors monitor?
Your blood
Pressure. Chemoreceptors?
Sorry,
Chemicals.
that's
Very good.
Chemical.
So you all immediately you have here. By the way, the chemoreceptors monitor this one. Okay, mainly that one. If it's oxygen, the chemoreceptors for oxygen, it's in your kidneys. They release your erythropoietin. So you see, so these receptors are part of your nervous system network, your brain stem. Remember the medulla has the cardiovascular center, remember? So that's why people with a stroke right here, you'll notice people with a stroke in their brain stem, they're the ones that have to be hooked to a cardiovascular machine to help the heart beat in response to this. We are not able now to respond to the level of carbon dioxide and the changes in blood pressure. So even though this beats on its own, this one helps when there's changes in blood pressure and levels of your carbon dioxide. How about your endocrine system? The endocrine system also helps, right? We studied a few hormones. What hormones? Sympathetic, parasympathetic hormones, right? Your epinephrine, norepinephrine. We know that. When you're getting nervous, has that ever happened to you? When you think that someone is following you, your heart all of a sudden is racing. What is that? It's an endocrine response. So what do? They can modify. But can the heart beat on its own even without these two? Yes. I remember that as a true or false question in your final exams. Yeah, as I would say, the endocrine system does not affect the fundamental. And I would make it in capital letters to confuse you or to scare you. And then you write false. It's a true statement. It does not affect the fundamental rhythm, whatever, the fundamental activity of the heart is not affected by your nervous system or your endocrine system. And so that's it. We're done with the heart. Okay? We're done with the heart. We're gonna look at our blood vessels, but I think after the break, I want to open up the heart.